Hi everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. So welcome back to my YouTube channel. So if you like my videos, please like and subscribe and share it with other fellow nurses or your friends who might be thinking to prepare for the NMC OSCE. Okay, today's video. Now, interesting one. I say interesting one because I do know that lots of nurses are still failing this station, which is the assessment station. I think my feeling is why they do fail assessment station because they think it's more complex than it should be. So my aim is today to explain it to you assessment station in a very simple, clear way, which is always my intention in these videos, to keep it simple and clear for you. So I'm going to kind of give you overview. What is assessment station? What are you supposed to do with it? What are the principles of carrying out a safe clinical assessment? And you know what your examiner is looking for, and what are the main points people are failing on it. So just kind of overviewing everything, and then I will send you where to then go and watch other videos to complete the whole pieces of the jigsaw. So I'm going to give you the pieces of the jigsaw in a bigger picture, okay? And then I will signpost it to you where you can go and get more information about the smaller pieces. That's the intention. We're going to keep it simple and clear what you're supposed to do in assessment station, because this is one of the most failed station in your exam, and it's with a real actor, and you will have to do the vitals and clinical assessment on this real actor. And it's the longest station in API is 20 minutes, okay? So we're gonna talk about in a simple way. So let's get started then. Let's talk about, we already said it's a 20-minute station, is with a real actor, so we know that. And the scope of assessment can be quite wide. Scenarios can be set in a clinical situation, in a community scenarios, like your GP has asked you to go in the community to assess a patient. It could be in hospital admission, your medical surgical scenarios, or it could be a neuro unit. So the patient is come on to the neuro unit, so it could be the neuro scenario. So let's talk about what is clinical assessment in a basic, simple way without complicating it. Clinical assessment is doing a assessment on your patient to work out their clinical stability in some sense. That's the simplest way, and that's what it is. And if you look in another different way on it, it is basically, just think you are admitting a patient, a new patient you're meeting, admitting onto a unit or a ward, or if you're in community, you are visiting them in community to do a clinical assessment on them, okay? So it's the starting process, okay, when you actually assessing patients' nursing need, when you're assessing their clinical situation by doing vitals and A to E assessment, all that, gathering all that essential information about your patient to be able to then plan appropriate care for your patient, then which goes into planning station basically. So that's what simple idea of assessment is. Clinical assessment is gathering information about your patient clinical situation. That's what it is. So that's the simple way. So now look at it. What do you get to help you? Because it would be not really easy to do a clinical assessment in 20 minutes if I didn't have any background knowledge about my patient. So to help you with that, so on the screen, as you can see, you get a patient overview of patient history form, okay? So which will tell you, the front sheet gives you the instruction whether it's a medical patient. Look on the top, it will tell you whether it's medical scenario, surgical, neuro, community, whatever it is. Then a set of instructions to tell you that you need to do vitals, A2 assessment, holistic assessment of your patient. Which chart you be completing is very clear on the front, okay? So do read it. Inside page tells you the patient details. So this is telling you patient over recent history. So their ID details, their presenting complaints, why they have come into hospital, or why you visiting them in community, what is the reason, what they presenting problems are, what is their past medical history, social history, then you have got medication there, and then their allergy status and reaction. So that kind of give you overview of your patient situation. So that's really important, because without that you will struggle to do a clinical assessment on someone. So that's why it's given. Now, do you have to memorize it? No, but you do need to read it and use it in your station, otherwise you will struggle. Other thing, if we now go on the next screen, it tells you the same document third page is A to E headings. So it's telling you that you do need to do A to E assessment. Don't forget that, okay? And then the back page of this template has your headings for physical, psychosocial, spiritual, and sexual needs. So they are telling you that you do need to do this bit in the part of the assessment as well. Don't forget that. So it's a simple way. This form is guiding you what you need to do. So they're giving you patient history, then they're saying, okay, go ahead, do vitals on your patient, incorporate them in A to E assessment and do their A to E assessment. Then of course, then go ahead and talk about their physical, psychosocial, spiritual, and sexual needs. So it's guiding you. So take that guidance from me, okay? So what else we get? So we get equipment to do it. So your blood pressure is with machine, your saturations are with machine, your temperature, you scan the patient forehead. They don't give you tympanic thermometer anymore for adults, it's just the scanning the head. Then your heart rate is with the fob watch. They're giving you fob watch to count your heart rate manually and your respiration manually. Heart rate for 1 minute, respirations for 1 minute. That's your full set of vitals, okay? So that's what you are given equipment wise. And then you given a chart to plot your vitals. It's news chart or GCS chart. GCS chart is for a neuro patient, news chart for every other scenario and every other diagnosis, okay? Whether it's community or hospital setting, everything else is on the news too. Your neuro scenario is on the GCS chart. So right, now next screen we'll talk about very simply about the main themes, okay? I'm not going to go through the marking criteria step by step. I've already done that in another assessment video, so you can watch that. But here we're going to talk simply about what are the main aims or themes of doing a clinical assessment on someone, and that will then answer your question where people are making mistakes to fail, okay? So what are the main themes? Of course, you know, we first thing, as soon as your 20 minutes start, you should read the patient overview history form. Do you need to really memorize it? No, you don't need to memorize it, but you do need to understand your patient clinical situation, background information before you do an assessment, because that's really important to do because you need to connect with your diagnosis when you do somebody's clinical assessment. So it's important that you understand patient history. You know why your patient is coming, what are their presenting complaints, you know, what is the diagnosis. You need to keep that in mind to do a safe clinical assessment. So that's the first thing. Now, do you need, like I said, you don't need to memorize it. You can refer back to this document anytime during your 20 minutes, but do understand what the information is in there. I'm just gonna say very simply, start of the station will be the same: scene safety, close the curtain, you know, clean your hand, introduction, ID check, allergy status. That goes without saying. You know that you have to do that in every station unless it's a written station. Of course, we're going to explain the patient what we're here to do a clinical assessment, what will that involve, and gain consent, valid consent. Now, then we need to start with the A to E assessment, vitals and A to E assessment. We need to incorporate vitals within the A to E assessment, and how to do that. I have already done a very simple video on it. There are 2 videos on A to E assessment, so you can go and watch that. So that will give you those answers, how to do A to E assessment accurately according to marking criteria, what your examiner is looking for. So I'm going to add the link of the video to the description of this video below. Next thing, we do need to chart vitals. So we have done the A to E assessment using our we've done the vitals A to E assessment. Now we need to chart those vitals. Either you chart on the news chart, or you chart on the, if it's neuro scenario, you chart on the GCS chart. In neuro scenario, you have to do extra things as well. Without complicating it, there is extra things which need to be charted on the neuro chart, which is your Glasgow Coma scale, which is your pupil size and reaction to light, and your limb assessment, strength for arms and legs. So that is extra work in neuro scenario, and is charted on the same chart as vitals. There is no news chart in neuro scenario. It's just the neurological observation chart has space for all those things plus your vitals, okay? So you do need to do that. Now, Next thing, now we done the charting. Of course, we have to then, if we're doing news charting, then we have to talk about how often you're going to do their vitals, who you will escalate to according to news policy. So you got to have very good understanding of national news policy. Okay. Again, I have done a news video, news charting video, and go and head to watch that. I've also done a GCS chart video, so go ahead and watch that. So these are bigger pieces of the jigsaw. So I'm showing you how they fit in bigger picture. But then for these videos, you can go and watch those videos, okay, on my channel. Next, once you've done all that, of course, you need to complete the holistic assessment of patient nursing needs. So that means you're going to look into their physical needs. You do need to look into psychosocial, spiritual, and sexual. Because remember, your template is guiding you. You already have the headings. What do you include in physical needs, psychosocial, spiritual, and sexual? Watch my other videos on different scenarios where I have covered what would you cover in a shortness of breath scenario, what would you cover in a surgical scenario, what would you cover in a neuro scenario, what would you cover in Alzheimer's scenarios. There's so many different videos on different diagnoses, so go ahead and watch them, how to do holistic assessment of patient nursing needs, because they're very much individual to the diagnosis, aren't they? In every scenario we do vitals, A2E assessment and all that, but this holistic assessment is very particular to that part, or depending on patient diagnosis. So I've done lots of different diagnosis scenarios, so go ahead and watch those videos. But that is what holistic assessment is. So you do look at patient physical problem. It means it could be shortness of breath, it could be mobility, it could be sleep, it could be malnutrition, whatever it is. Then the psychosocial status, how they're feeling psychologically. Is there any family needs? Is there anything else like that? Spiritual needs, any sexual needs, about protecting your patient's sexuality. Is there anything you need to do about that, protecting their privacy and sexuality? So like I said, it's already explained in other videos. And then that is the general theme, and then you need to adapt it to your different scenarios, and adaptation will come more in like holistic assessment part, where you have to adapt according to your scenarios, diagnosis, okay, and patient presenting complaints and all that. Because I'm not going to talk about shortness of breath if my patient doesn't have shortness of breath. I'm not going to talk about pain if my pain is not the patient presenting symptom, or they're not experiencing any pain at the moment. So again, so like I said, it's adaptation to the scenario. Right, what are the common fails? That brings us to common fails. Why people actually failing this station so much? I think, in my opinion, they're making it a lot more complicated than it is. All you need to do is, this is my patient diagnosis, presenting symptom, all this patient history. Now I just need to do a safe clinically assess my patient safely and show my competence to the examiner. That's where you need to keep it simple. Where they fail is performing vitals and A2E assessment. It has to be done. A2E assessment has to be done as per the marking criteria. You can't leave anything out. You might think it's a very simple thing to leave out, but it's not. Examiner will be marking you against the marking criteria. So do watch the video and do look at the marking criteria. I go through it with you in the video. Next thing is charting. Charting is again a documentation. It has to be clear, simple, accurate, okay? Very clear, legible and accurate. There is no room for error when it comes to charting on your news chart or GCS chart. So please again watch my videos. They will give you guidance on that. Next thing people fail is again on holistic assessment, because they're not adapting to their scenario. They're not keeping patient diagnosis or presenting symptoms in their mind. They just think, well, every assessment is the same. I just carry on and ask few questions. Whether it relates to my scenario or not, I will be fine. But no, you will not be fine, because like I already said to you, I can't talk about pain if the patient is saying I don't have any actually real pain. Might be pain score of 1 or 2 or 3, but that's not a significant amount. If it's not a significantly important need for your patient and you keep talking about it, basically you're just running out of your time really, but you're not saying anything useful, because your examiner is looking for you to connect to your scenario and talk about appropriate needs, and they're given in your patient history form, they're given in your presenting complaint. So you do need to use that form. Again, I'm telling you, you need to use that form very sensibly, okay, to get your guidance from it. And don't forget, it's not just the physical needs we're looking at. We are looking at psychosocial needs, and they're given you social history of your patient. We are looking at the spiritual needs, and we're also looking at protecting their privacy and dignity in their sexual needs. So that has to be there. So that's the reason not connecting with your scenario will not be a great plan. Okay, that will not get you a pass in this station. So make sure you are connecting to your scenario and keeping that in mind. It's not all size, one size fit all. It's not like that. You do have to adapt to your scenario, and I have got lots of example YouTube videos for you to watch on my channel. So I hope all this makes sense. I hope I have tried to keep it simple, to explain it to you what is the main themes of assessment station, where people are getting it wrong. Hope it helps. Keep watching the videos. If you want to get more information about our training, online, face-to-face, mix of the two, we provide it all. Visit us on OSCE-training.com. Email us on OSCE-training@outlook.com. I will soon be back with another video for you for your NMC OSCE exam revision. So bye for now.